Patient presents with three symptoms: tenosynovitis, synovitis, and immune-mediated inflammatory diseases.
I believe that these symptoms point towards a diagnosis of rheumatoid arthritis.
You might be right, Leslie. However, I think the symptoms could also suggest fibromyalgia.
I see your points, but let's not forget about systemic lupus erythematosus. All three could possibly fit into that diagnosis too.
Look, you're all trying to complicate this for no reason. The patient clearly has craniometaphyseal dysplasia. I'm ordering vestibulectomy as the treatment. It might be risky, but we have to do what's right. Tracy, I know you have your doubts about this, but I really believe that performing the vestibulectomy on my patient could save their life.
I understand your concern, Hawks, but I think we should explore other options first. This is a rare case of craniometaphyseal dysplasia, and there might be more conventional treatments available.
Sometimes the right thing to do is taking a risk for the greater good. My patient's condition could deteriorate rapidly if we don't act now.
I understand your point of view, Hawks, but I think it would be better to consult with other experts in this field before making any decisions. We need to ensure that our patient gets the best possible treatment available.
All right, Tracy. Let's take some time to gather more information and seek advice from others. But I hope you won't disregard my request too soon. My patient is counting on me.
I can't believe this is happening. We had no idea craniometaphyseal dysplasia could result in such drastic complications.
And it's all due to Hawk's overconfidence and stubbornness. He should have been more cautious with his diagnosis.
I know. But we can't dwell on the past. We need to focus on finding a solution for this patient now.
What do you propose then? I mean, it's clear that vestibulectomy is not the answer.
I'm still researching possible alternatives, but my gut feeling tells me that we should look into some sort of genetic therapy or gene editing technique.
Gene editing. That sounds like an ethical dilemma in the making.
I don't want to hear you mention the idea of ethics ever again, Hannah.
That's rich coming from you. You're a sick person yourself.
This place makes anyone go mad.
You fools. You nearly killed him with your incompetence.
What do you mean? We did everything by the book.
We have years of experience in our field. What could we have possibly done wrong?
I think it's obvious that the patient had craniometaphyseal dysplasia and vestibulectomy was the correct treatment for his condition.
You idiots. The patient doesn't have craniometaphyseal dysplasia. He has something much rarer. Like a unicorn in a room full of donkeys.
What could this rare diagnosis be then?
Perhaps you should tell us, Dr. Hawks.
Oh, I'd love to see your faces when I say it out loud. Okay, here's the diagnosis. The patient is a human being with a brain that works in more ways than just one. And you idiots nearly killed him because you thought he had a rare condition that only exists in medical textbooks.
Oh, so groundbreaking. So witty, Hawks. Get lunch.
Well, Johnson, it seems you've been keeping yourself busy with all those cancer patients of yours. How's that oncology department treating them?
It's going well, Hawks. We're doing our best to make sure each and every one of my patients gets the care they need.
Oh, how noble. I'm sure you do your best in that best-selling oncology department. Tell me, Johnson, are these patients yours, or just someone else's?
They're all under my care, Hawks. Just as they were when you were working with me.
Yes, those were the days of glory, weren't they? When I actually cared about my patients' well-being and not just my own bank account.
I think you've always been more interested in the money than your patients, Hawks. That's why your current patient is likely headed to, well, wherever terminally ill people go when they can't pay for better care.
You know what? You're right about that, Johnson. I'm just a glorified ambulance chaser. But hey, at least my patients are treated by someone who actually gives a damn.
Unlike you, Hawks, I do give a damn. My patients aren't just numbers to me. They're people with families and stories. And I will fight tooth and nail to ensure they get the best care possible.
You really are a saint, Johnson. While my patient is rotting away in some forgotten corner of this hospital, you're out there being a hero for yours. You know what? If only you'd have been their doctor instead of me.
Well, Hawks, maybe if your hero act hadn't turned into a cash grab, things would worked out differently for them.
Maybe so. I think I've finally figured it out. You're patient. Not my problem anymore.
Gentlemen, what's even going on in here?
This is so out of character.
Get the hell out of here.
My apologies for my unprofessional attire, but I believe we found a crucial clue in this case.
You're endangering everyone's life with your reckless disregard for the rules, Hawks.
I concur with Leslie. You need to put on some proper equipment before you can continue working here.
Absolutely correct. We cannot have someone running around like a cowboy in a real-life medical drama.
I understand your concerns, and I assure you that the solution is not something we want to risk missing out on due to any minor rule infraction.
The lives of these children can't be jeopardized over a diagnosis. There's no excuse for this behavior, Hawks.
So what's the diagnosis?
You know, I'd be better off if it weren't for those idiots in my diagnostics team.
I'm sure you're being facetious, but your team isn't exactly incompetent. You seem to have missed that yourself.
They should be more careful.
Careful. You admitted to giving the wrong diagnosis because you didn't know what you were talking about.
That was an isolated incident.
It's not just one time, Hawks. I've seen it multiple times with your patients, and you're always quick to blame others. It's a pattern of behavior that needs addressing.
Well, address this. Hawks extends a middle finger and leaves the room dramatically.
What?